This is a quick video about what vitamin supplements that the baby needs. So when a baby is born, we usually start vitamin D drops to the baby. And the reason we recommend vitamin D to all the babies is because the mother's milk is deficient in it, and vitamin D, as we all know, is in the forefront of medical knowledge, and it is involved in so many aspects. In addition to the bone calcium metabolism, it's also related to immunity, it's also related to allergy, it's related to mood and development and so on. Because it has a multiple role in different systems of the body, we don't want the baby to be deficient at a crucial phase of their growth and development. So we give 400 units of vitamin D. The question arises as to whether the formula fed baby needs vitamin D. Most babies are partially breastfed, and sometimes a little bit of formula may be there. If you are exclusively formula feeding, you can give a reduced dose of vitamin D to them, aiming for a total dose of 400 units per day. If you are on partial breast and formula feeds, it's better to give the full supplement. And the reasoning behind giving a full supplement even to formula fed babies is that the infant formula contains vitamin D, but you need nearly 1 liter of milk a day to reach the 400 units of vitamin D. So you give the full supplement to the formula fed babies, it's not going to harm them, because 600 units per day is a acceptable range as well. When you choose the vitamin D preparation, you can choose the concentrated forms, but be careful if they don't have child locks, because the older siblings may take excess by accident, and don't give more than the baby needs, because these are concentrated. 1 drop may give you as much as 200 units, so be careful with the dosing. Oil-based preparations, you have to be careful not to choke on it, so always put in the side of the mouth, like direct the dropper into the side of the cheeks, and the baby is aware that something is coming and they start swallowing, and drop it slowly. There are missile preparations which can be put in the milk along with it if you are bottle feeding, but if you are breastfeeding, you can go for any of these preparations. After 4 months in a breastfeeding baby, we consider introducing iron supplement as well, and if it's a premature baby, we start the iron supplement earlier, especially the babies below 32 weeks of gestation. The iron supplement is continued usually till the baby is regularly taking diet rich in iron, which is meat products mainly. Vegetarian diet tends to be low in iron. We will discuss that in a separate video. So in terms of multivitamins, if a formula fed baby is getting vitamin D and some iron supplements, if the nutritional iron, dietary iron is not enough, it's adequate. In a breastfeeding baby, you usually continue the vitamin D till 6 months, and then you can start the multivitamin at 6 months as well. A formula fed baby, you may give a multivitamin as well after 6 months, but it's not essential. So normally we continue the vitamins and iron till 1 year at least, and by 1 year you can stop the iron supplement if the dietary iron intake is assessed to be adequate. In vegetarians and where the iron intake is not adequate, you may give it for a longer period of time, 18 months to 2 years. After 2 years until 5 years, vitamin D is still recommended in some form or the other. So if you manage enough sunlight, if you have enough dietary exposure, you can give once in 2-3 days if you want recommended daily allowance to meet it. Testing for vitamin D deficiency is not necessary unless there are any concerns. So there are different world body recommendations on these supplements. Giving calcium to healthy children is not essential. If for any reason you are not able to take dairy products adequately, you may consider a calcium supplementation. Routine calcium supplementation around weaning is not essential. If the child has an episode of diarrhea, for example, additional zinc can be considered as well. But mostly if you have enough fresh leafy vegetables and meat products, there should be enough zinc in your diet. So I hope this is helpful, and please do share. Thank you.